Good afternoon, everybody. It's Kevin Stevenson. Thanks for joining me today on I Don't Care with, sure, me, Kevin Stevenson. So today's guest is Stuart Long. Stuart is the CEO of AIBionic. Stuart, welcome to I Don't Care. How are you?
Great to be here. Thanks for having me. Really appreciate it.
Absolutely. Well, tell everybody in my audience a little bit about you and a little bit about AIBionic
Sure.
because I find it really fascinating. I've had a chance to look at your webpage and a lot of really interesting stuff going on.
Well, yeah, it certainly is for sure, especially in cardiovascular. So, a little bit about me. I've been involved in healthcare pretty much all my life. My mom was a nurse. I've been surrounded by nurses and physicians my whole life. So, I grew up. I've been in the business side about 30 years now, and so I know I'm pretty, dating myself there quite a bit, but have been around for a lot of the first. So I went. I go way back from switching from film to the digital world in healthcare, from manual charts to electronic charts to manual insulin dosing to letting a computer predict how to do that for staff. And here we are, AIBionic, and we were the first company to put cardiac monitoring in the cloud.
Okay, very good. Yeah, I think you and I are about the same age because I remember all those too. That's a little frightening. Can't believe 30 plus years has come by that quickly. But
Yeah,
it's amazing all the changes that have happened in healthcare too.
it is.
I
It
mean, that's
is.
been really fascinating to
And
watch.
if Moore's law has anything to do with it, we'll see 30 years of evolution in the next 10, right? So
Right. Absolutely. So talk a little bit about Infobionic and what you're doing in the cardiac monitoring world.
we have a device that if you're a patient, if you've known anybody, any of your family members, if you're having some symptoms, it could be heartburn, could be dizziness, it could be a variety of things, skipping of the heart. Some people feel the outward signs of heart problems differently. But if you're having that to the degree that you talk to your doctor, the doctor will say, well, that does sound like it's something we need to figure out what's going on. It might be on the electrical side of your heart, not on the plumbing side, kind of like electricity and plumbing for your house. So on the
Sure.
electrical side, he'd say, let's put a monitor on you. So either come to the office or we're going to have one mailed to you, and you would either put that on yourself or go to the doctor. They'd put it on for you, and then you'd go home and we would monitor you remotely. And so what we do differently than a lot of folks is we stream your data up to the cloud. We use some really good FDA approved artificial intelligence to help the physicians not only see the data quicker because we can get it off of you and back to them, but then we can help them get to the do you have a problem or not have a problem much sooner.
Yeah, absolutely. You're kind of in my wheelhouse here because I've had a number of family members with cardiac issues and many that have been monitored long term. Had a good friend of mine very recently was on a monitor and went to take a remote job elsewhere. He was down in Florida and received a call from his cardiologist and said, "Hey, what are you doing? What are you doing different right now? Something's not right."
Yeah.
And he said, well, he told him what he was doing in that job. He goes, you know what? I think you need to find a new job because the stress level that's creating is putting some undue stress on his heart. Yeah,
Extremely
ended up
common.
coming back home. Yeah, ended up coming back home, had a procedure. He's doing
Yeah.
great. But you know what? The physician found out very quickly and told him to change his lifestyle, and he was smart enough to do
Yeah.
that. So, which kind of leads me into this whole thing. We just went through kind of a pretty stressful week, let's say, huh?
Mhm.
With the
Oh,
election,
yeah, a
whichever
little bit.
side you're on, and on both. And
Yeah.
that's one thing that I've seen it in my career in hospital administration. Stress will, stress can kill you,
Mhm.
and stress puts incredible strain on your heart. You may not even know it, but it does. And so, let's talk a little bit about that. Heightened stress, anxiety. What does that do to the heart?
Absolutely. I think, it's interesting when you talk about we're in the same wheelhouse. You know people who this has happened to, and right. So
Yeah,
the cardiovascular disease incident rate is close to 80, 50% at least in the population. So there's two of us on the call. So one of us has
yeah.
felt it, right? So it's really prevalent, and it's really has to do a lot of with how it all starts, right? And stress, anxiety are big contributing factors, especially if you have hereditary traits that might lead you to that point, or lifestyle choices, right? So If you look at the plumbing side of the heart, plaque is a big problem that gets built up into the vein. It's a big leader to heart attacks. But it's, if you think about all the food that you put in your mouth, if you didn't brush your teeth, the dentist would have something to say about that, right? But we can't brush the inside of our heart. So we have to make some really good choices early on. But stress and anxiety, even with food alone, we eat to relax and reduce stress. But if the input of that food is not heart healthy, if it's not the kind that brushes the inside of your heart, those all have compounding effects. And the longer you leave it untreated, or you don't get it diagnosed early enough, like the colleague, your example, you found it early enough, they did the procedure, and everything's fine. If you leave it just a little bit too long, in some cases, sometimes it can go the other way. And stress has a big impact on that.
As I said, just for the physician to be able to get that information so much quicker, saves heart muscle, saves hopefully long term damage, if you can get something done pretty quickly. But going back to InfoBionic, you're talking, a lot of my guests have been talking about AI. So yeah, it gets it to the cardiologist sooner. But what else does it do to to that data, scrubbing it, cleaning it, and all that? Because that's what I'm finding with a lot of my other guests. They say, it not only it advances the process, it makes it much more efficient, but it's so much more effective. Let's talk a little bit about that.
When we talk about AI, there's really a couple of different kinds. I kind of put them in two big buckets. One is just workflow efficiency, making it easier, assembling. Your heart beats over 100,000 times a day. If you're on the monitor for 14 days or 30 days, that's millions of heartbeats. So we need to make it easy for the clinicians who now are getting that data through the cloud. It's streaming. 100% of those heartbeats are coming through. How could you possibly look at a million heartbeats? You can't. So we have to make the information available to them much more cogent, and we have to prioritize that in such a way that we bubble the important stuff up to the very top. So that's one way we use AI to do the efficiency piece. I guess I'll back up to the very beginning. One of the most important things is that old adage, garbage in, garbage out. So we take whatever we get from the heart, because in the remote environment, it's very difficult because you're moving all the time. You're not stationary like you are in a hospital. So what we figured out was how to do some fairly sophisticated signal processing on some very noisy information. And then we were able to train that data using machine learning, which is a form of artificial intelligence, and then create algorithms to help assess, once that signal gets cleansed and what it's looking at, to kind of sift through the noise. And I'll give you a couple tidbits here.
Okay.
We did a look at atrial fibrillation, which is the most common arrhythmia that's out there, number one. And
Got a close family member that has
exactly,
it, so
yeah.
absolutely.
It's the most prevalent, and it's very expensive to treat. And if you don't find it early enough, right, to that point we made earlier, it has a very high, what we call, comorbidity rate. So it has a high impact and a very high cost, right, to go with that. So we did an analysis where we put 3 different wires on the patient, and that creates 3 little squiggly lines. Now, if you put 1 wire on a patient, you'll get 1 squiggly line. So we have 3 little lines that go by. So we mathematically were able to recreate 3 additional squiggly lines. So a total of 6, right? So the gold standard is 12. That's what you get in the hospital. So now we've created 6. We use our world-class signal processing with machine learning, and we get an exceedingly high, really high quality signal. And so we're known for that. So we actually can achieve very close to inpatient monitoring level quality signal.
Okay.
And in this particular instance, what we found was, in the 6 squiggly lines, we have like a noise canceling headphones effect. When there's a lot of noise in 5 of those lines, 1 of them would be just normal, and we can see through the noise that way. So it's really impressive to be able to use the technology. And what we found was, in atrial fibrillation, there's a high incidence of false positives. So you take the Apple Watch, and it says you might have a problem. Well, there's the incidence of that being wrong is very high, right? So that's a false positive.
Right.
So what we found after instituting the analysis of creating this noise canceling effect, we reduced the atrial fibrillation false positives by over 85%. And so that's the power of where AI comes in. And I'll make one last final point, where we've collaborated with the Mayo Clinic on this. And one of the chief physicians at Mayo Clinic, his quote was, "The most important thing we can do is see what's happening at the time that it actually occurs." So we're working with them to bring to market their research that they do in AI for ECG. And so that what they've set as their charter is to detect latent disease much sooner. And so they're using your ECG now to look at other factors that are going on, other parts of your body, whether it's high blood pressure, obesity, diabetes, other things, and puts all those together, and it can detect and have a high degree of accuracy, I'll say, in terms of predicting whether you're going to have atrial fibrillation, cardiomyopathies, or some other kind of thing.
Sure.
So to try to detect earlier. So we're working with them right now. They've got approval on their first algorithm. We're working with them to bring that to market they did that on a 12 squiggly lines, 12 lead. We're going to get that approved for 6 lines and do it in a remote world so that we can now start detecting diseases much sooner and be able to give information to the clinicians that they might normally have to send the patient to the hospital to get an ultrasound, to get a blood test. Now you wouldn't have to do those things.
Okay. You brought up something because my family member, obviously the AFib is very sporadic. It may not occur for 2 or 3 days, and it's a very very quick event. But when you said that, I'm like, yeah, being able to detect it when it happens, because there were a couple of times that she was on some monitoring and everything was great.
Sure.
I mean, nothing happened, for a significant period of time, and then pretty much as soon as she got off the monitor, it's like, oh, I had an
Again.
episode. Yeah.
Yeah.
And
Yeah.
so being able to detect that and clear through that noise and really, narrow it down to exactly when it happens and see that immediate
Yeah.
impact.
It's really important. It's probably one of the key elements, I think, in terms of what we call now continuous monitoring. Right? It's continuous monitoring has been around for a while, and I have a personal story. I have what we call paroxysmal atrial fibrillation. It comes, I didn't have AFib, but I had this intermittent, very high heart rate. And they said, hey, you know what? That's going to turn to AFib at some point. Let's just watch you. So I have a monitor I keep with me, nearby at all times. And so it finally turned to AFib, but we were able to detect it, and now it's all early detection. And so I think that the idea that um, being able to monitor continuously, but even though your arrhythmia is intermittent, you have to be able to capture what they call the burden. How often were you in
Yeah.
that arrhythmia during the time that you worn it? And so there's all sorts of statistics that the doctors rely on to say if the burden is at a particular level, we need to act now or change your medication, or we don't have to do
Yeah.
anything. We can keep you on the current path that we're on. We'll just watch and wait, which is kind of where the bucket I landed. But having that information coming off of you and in front of a doctor as little as 3 minutes, with that amount of information being factored in with the artificial intelligence and the analytics, so the doctor doesn't have to really decipher too much very quickly. We can kind of present it. They can look at it, and make their determination like that.
See, and you talk about, continuous monitoring. Hey, who among us doesn't have, the CGM now
Exactly.
for their glucose?
Yeah.
You know, I got one, and I've gotten, so used to it now. I play with it on my phone. Okay,
Yeah.
let's see, what did I eat? Holy cow, don't eat
Yeah.
that
Like almost
anymore.
gamification, right? Yeah.
Yeah, yeah, and so I'm sure, with folks who are continuously monitoring their heart, it's great because it can allow you, hey, I'm feeling a little bit stressed, let's take it down a notch,
Yep.
or if I'm in the middle of some sort of an exercise, like
Well, and it's interesting because I wear a watch Fitbit, and I track all my stuff. And so does my wife, and so she was late to the game with the smartwatch, but she finally I didn't try to convince her, but she got to the party late. However, it has if you interact with your watch and confirm when it detects something, it gets smarter, and it's become a real tool for her to do exactly what you just said. You either need to slow down, or today you can push it a little bit, or did I just eat something and I'm feeling something in my chest? Did I eat something wrong? So it answers a bunch of questions, and so it's been really beneficial for her. And I think that when it comes, and it's specifically around kind of managing stress and anxiety, it'll stop and tell her, did you just have a stressful moment? And she'll stop and look at it and
yeah,
go, what happened? I just had a phone call, or a work call,
right,
right. It knows
or
to
yeah,
differentiate between walking or versus your elevated heart rate when you're kind of in a resting state, just kind of walking around your house. So
Yeah.
So I think those are all great ways when you think about the tools that are available to us in continuous monitoring. It's not just
Okay.
cardiac; it's just kind of yourself, quantified individual to some degree. We're all getting used to that in these days, and online meetings. We never would have had these
Right.
before the
Who'd have
pandemic.
thought? Yeah. Hey, so how does your technology, how does this work and improve health equity and access? Because that is such an issue. Obviously, I'm here in Texas. We're very fortunate, blessed with significant access. We're in a larger city, but I could go 25 miles west of here, and you start seeing the access points just plunge. You got into West Texas, and it may be 50, 75 miles to the nearest doctor. How can this help with equity and access?
Yeah, absolutely, and it's a great question, and I think it's probably one of the best enabling technologies for health equity, because there's a lot of scenarios where the insurance companies they have a lot to say about which tests you can do and when,
Right.
and what are the symptoms for that test, and oftentimes they require that you do a 2-day or a 1-day monitor, and if it's negative, okay, then we'll move you on to a different monitor. So
Sure.
and that generally creates, if you're a rural patient, some people will drive a couple hundred miles to the nearest tertiary care center that has the technology. They'll have to either get a hotel and wait the period out. If they can't do that, then they have to turn and drive home. It's negative. They got to turn and come back, get a different monitor, and so that makes the availability much more different. Now, in our world, our monitor only does one kind of monitoring. We can do all of the tests that are required by the insurance companies on one monitor, and it can be mailed home to you. So, speaking of Texas, we've got a distribution center and an office down in Texas, just south of Fort Worth, and so if there are some rural folks in Texas that are having these issues, you can even have a telehealth visit with your physician. They can call us up. We can have, or we can ship a device to them. They put it on themselves, and then when they're done, they package it up and ship it back. Meanwhile, they're being monitored, in near real time, and somebody's on the other end of that wire watching. See what.
Yeah, that's always an issue that jumps up to me. I have a real passion for rural healthcare too. I spent some time out in rural confines of Nebraska and Kentucky, and so that's great to hear about that. So let's shift a little bit. Of course, I creeped you on LinkedIn because that's what I do. I got to find out more about you. And I see one of the positions you have listed is mentor, and mentoring is something that is really near and dear to my heart. I was the president of the American College of Healthcare Executives North Texas chapter a few years back. We're known throughout the country for our mentorship programs. So, again, and here in my current hospital, I oversee all of our administrative residents at our local university, and so I get a chance to spend what little wisdom I have left in my brain to a lot of
Pay it
folks.
forward, yeah.
So what do you do? How did you get involved in mentorship? And tell me a little bit about that journey.
Yeah, so it started, gosh, a long time ago. There was a company that reached out to me. It's kind of like a dating service. You sign up for free with them, and to be part of their mentor program. And so then they sign up with companies, and then those companies will say, I have these employees. They can either be top performers or mid performers or even low performers that would need some help. And so based on the company's needs and that particular employee's needs, they'll match a mentor based on skill sets, but it's never in the same industry. And so I've been doing that for, it's probably now more than 10 years. I'm not quite sure, but it's something that I'm deeply passionate about and I truly enjoy. I have a mentor, multiple mentors myself. So I've always believed that there's people have blazed a trail and done great things, and we can learn from all the wisdom of those that have gone before us and been successful, and learn, and people who've learned how to make mistakes and overcome them, right? So there's that element that's the path to success is littered with failure, right? So I've been doing that, and I absolutely love it. I learn more, I think, than I teach. So I kind of go in with that mindset to learn really about what it is that drives them, and what do they want to do, and how do they think they can get there, and then what skill sets or what knowledge. It's been a lot of fun.
Yeah, you just said something that I tell everybody that's interested in mentoring and they haven't done it before. Say, look, you're going to get so much more out of it than you put
I
into
I
it.
I,
Frankly,
I learned that,
yeah.
yeah, Yeah,
Yeah.
for sure.
So, so in our last couple of minutes, anything more that you'd like to touch on with InfoBionic? What do you? I mean, obviously you got the cardiac monitoring down. You thinking about going into some other monitoring maybe down the road?
Yeah, definitely, for sure. There's a lot of tangential things around what we do. Sleep monitoring
Ah,
sleep apnea is
there you go.
very critical to atrial fibrillation, as a matter of fact.
Sure.
Glucose control, cardiovascular disease, they go hand in hand, diabetes. There's a lot of monitoring that can be tangential and associated to that. But I think if I look at our horizon just in the next 36 months with our collaboration with the Mayo Clinic, we're going to focus on trying to bring as many um, uh, algorithms that can be detected in your ECG. Believe it or not, there's a lot hidden in that electrical signal that we never
Yeah.
knew existed. And that's what one of the things that the AI does. And Mayo is a big researcher on that, to bring all of those things that you can detect in the heart without having to go get these other tests, and see how early we can detect it. And that starts, that moves us up in towards the hospital space and trying to get people out faster. But at the same time, we need to get your blood pressure. We got to get your blood oxygen. We've got to do some other vital signs. We need to be able to communicate on video. We need to be able to have a form factor that can start in a hospital and go all the way out to your wrist, depending on where you are and what how complex your care is. So I think you'll see us stay true to our nature, but probably those kind of rings on the bullseye as we go out from the center. We lean towards those markets like sleep and other kinds of continuous monitoring that are um, uh, correlations to cardiovascular disease that aren't necessarily thought of as cardiovascular.
Yeah. Okay. So let's talk a little bit. I'll let you give a little commercial here. Who are your main customers now? If somebody listening to my podcast here wants to get more information on InfoBionic, how can they do that?
Yeah, well, I'll maybe see it first and when we close, but the website, easy way to find us is infobionic.ai. In fact, we renamed the company to that exact name, so it's not only our name, it's our website. But I'd say we're known for our quality, and if I had anything for the listeners, if it's a consumer or a patient, is talk to your doctor, talk to them about continuous monitoring. We were first to market about 8 years ago with continuous monitoring in the cloud, but you can't not get it in today's world. So there's you can't really get a bad monitor, although there's different kinds that don't communicate. I'd say shy away from those. The more squiggly lines, the better. But there are use cases like AFib where one lead patch that you can stick on and wear it
Yeah.
is perfectly fine. And so I'd say just talk to your doctors, because I think in that world where patients are educated and want to talk to their clinicians. I can tell you, my wife, she was at the doctor. She had some test results come in, and she saw them on her phone before the doctor got back to the room. So that's how fast. That's how much that's the speed at which it can really help. And the consumer, and so she joked, it's like, I got my results before you got here, just a little to poke them. But it's that's the power that the patient and the consumer have today, is to help drive their own healthcare. And I'd say that's really the biggest thing, because a rising tide floats all boat. We all benefit from that, and kind of our charter is think about the patient first.
Well, very good. Well, Stuart Long with
You
InfoBionic.ai.
got it.
I'll give the correct company name. Sorry about that.
No, no.
It's been a real pleasure having you on. I don't care today with me, and look forward to hearing more from you. Love to have you back on the show. Maybe a year or 2 years down the road, hear more about your Mayo collaboration, but also hear more about new products too.
Happy to come back. Thanks for having me.
All right, everybody. Another great episode of I Don't Care with me, Kevin Stevenson. I hope you've enjoyed it today. Tune in again next week for yet another great guest on I Don't Care. Have a good week.